Understanding CPT procedure codes is crucial for accurate medical coding and billing practices in healthcare settings. Welcome back to my YouTube channel. If you are new to my channel, welcome to MedCode Insight. Hi, I am Nishaba, a certified medical coder. In this video, we will explore the procedural codes of pelvis except hip and upper leg except knee region. Embark with me on the journey of code exploration. Pelvis except hip, the next anatomical site of anesthesia CPT. The pelvis is located between the abdomen and the legs, and the hip is the area on each side of the pelvis. The main part of the pelvis is ilium, ischium, and pubic. First code is 01112. Anesthesia for bone marrow aspiration and or biopsy, anterior or posterior iliac crest. Aspiration is removal by suction of fluid and cell through the needle. The iliac crest is the most prominent part of the ilium. The provider performs anesthesia services for a patient undergoing the procedure of either bone marrow aspiration or biopsy or both. The procedure site is the anterior or posterior iliac crest. Next code is 01120. Anesthesia for procedure on bony pelvis. Next code is 01130. Anesthesia for body cast application or revision. Cast applications mean plaster. Revision means redoing the procedure. The provider performs anesthesia services for a patient undergoing body cast application or revision. Next code is 01140. Anesthesia for interpelvic abdominal hindquarter amputation. Hindquarter amputation is an operation involving removal of entire leg and part or all of the pelvis associated with it. The provider performs anesthesia service for a patient undergoing anesthesia for procedure which is the removal of one half of the pelvis as well as one entire lower limb. Next code is 01150. Anesthesia for radical procedure for tumor of pelvis except hindquarter amputation. Next code is 01160. Anesthesia for closed procedures involving symphysis pubis or sacroiliac joint. Closed procedures involves making small incision or punctures to access the surgical site. Surgical instruments such as endoscopes or laparoscopic instruments are inserted through the incision or puncture to visualize and manipulate internal structures. Next code is 01170. Anesthesia for open procedures involving symphysis pubis or sacroiliac joint. Open procedures involve making larger incision to directly access and visualize the surgical site. The surgeon had direct access to the surgical area and can visualize and manipulate tissues using conventional surgical instruments. Next code is 01173. Anesthesia for open repair of fracture, disruption of pelvis or column fracture involving acetabulum. Acetabulum is the socket of the hip bone into which the head of the femur fits. Upper leg except knee, the next anatomical site of CPT anesthesia. First code is 01200. Anesthesia for all closed procedure involving hip joint. Next code is 01202. Anesthesia for orthoscopic procedure of hip joint. Orthoscopy is a procedure for diagnosing and treating joint problems. The provider perform anesthesia services for a patient undergoing an arthroscopic procedure of the hip joint. Next code is 01210. Anesthesia for open procedure involving hip joint not otherwise specified. Next code is 01212. Hip disarticulation. Disarticulation refers to the disconnection of all or part of a limb from the body, especially through the joint. The provider perform anesthesia services for a patient undergoing an open disarticulation procedure of the hip joint. Next code is 01214. Total hip arthroplasty. Artho means joint. Arthroplasty, a surgical procedure to replace parts of the hip joint with artificial implants. Next code is 01215. Revision of total hip arthroplasty. The provider perform anesthesia services for a patient redoing total hip arthroplasty for specific needs. Next code is 01220. Anesthesia for all closed procedure involving upper two-thirds of femur. Femur is a long bone that extends from the pelvis to the knee. It is also known as thigh bone. Next code is 01230. Anesthesia for open procedure involving upper two-thirds of femur not otherwise specified. Next code is 01232. Amputation. The provider perform anesthesia service for a patient undergoing removal of the leg at upper two-thirds of the femur or the thigh bone, the long bone that extend from the pelvis to the knee. Next code is 01234. Radical resection. The provider perform anesthesia service for a patient undergoing a procedure of an extensive surgical removal of tissue of upper two-thirds of the femur. Next code is 01250. Anesthesia for all procedure on nerves, muscles, tendons, fascia, and bursae of upper legs. Nerves receives and send messages from the body and the brains. Muscles are pieces of soft tissue throughout the body that can contract and produce motion. Tendon is a connective tissue. It attaches the muscle to the bone. Fascia is a sheet of connective tissue. It surrounds every part of our body. Bursae are small fluid-filled sacs that reduce friction between moving parts of body joints. The provider perform anesthesia service for a patient undergoing any procedure on nerves, muscles, tendons, fascia, and bursae of upper leg. Next code is 01260. Anesthesia for all procedure involving vein of the upper leg, including exploration. Veins are the blood vessels that carry blood to the heart from tissue and organs in the body. The provider perform anesthesia service for a patient undergoing a procedure of veins of the upper leg, including an exploration. Next code is 01270. Anesthesia for procedures involving arteries of upper leg, including bypass graft, not otherwise specified. Arteries are the blood vessel that carries blood from the heart to the tissue and organs in the body. A bypass graft is a surgical procedure in which a blood vessel graft is used to reroute blood flow around a blocked or narrow artery. The provider performs anesthesia service for a patient undergoing a procedure on the arteries of the upper leg that includes placement of bypass graft. Next code is 01272. Femoral artery ligation. The provider performs anesthesia service for a patient undergoing ligation and bypass graft placement of the femoral artery in the upper leg. Next code is femoral artery embolectomy. An embolus is a block in an artery that can originate from blood clots, air bubbles, fat particles, or foreign substances. Ectomy means removal. The provider performs anesthesia service for a patient undergoing surgical removal of embolus and placement of bypass graft of the femoral artery in the upper leg. If you have any question or need further clarification, feel free to ask in the comment section or reach out via email. Thank you for watching. If you enjoyed the video, please like, share it. Your support means a lot to me. If you haven't already, consider subscribing for more. Click the bell icon to receive notifications. For more detailed guidelines, CPC mock or exam related questions and notes, email me at my given email ID.